Hey everyone, good morning, good afternoon, good evening, wherever you happen to be. Welcome back to another Ask an Expert session. Happy to have you. My name is Ryan. I'm part of the communications team here at the IKEA Foundation, and we're thrilled to be talking about something really cool today. Since COVID-19 hit the world, healthcare workers are local heroes and role models. How amazing would it be if they not only fight the pandemic, but also climate change? Today, I'm happy to have Edgar van den Broek, our program manager for climate action, to speak about just that, with Josh Karliner, Director of Health Care Without Harm, and Dr. Maria Guevara, International Medical Secretary for Médecins Sans Frontières, or Doctors Without Borders. Don't forget, you can ask your questions in the chat. We'll do our best to answer as many as we can. And right now, say hey, say hello, tell us where you're visiting from so we can see who's joining us and where you're from. With that, Edgar, over to you.
Thank you, Ryan. Yeah, so at the IKEA Foundation, we help families create a better everyday life and protect the planet. Being part of the climate action team, we support partners that help reduce greenhouse gas emissions so our planet can stay within the limit of 1.5 degrees Celsius global warming. We believe that with unprecedented collaboration, we can make that happen. One of the partners we work with is Healthcare Without Harm. They are working hard to reduce the environmental impact of the healthcare sector. If the healthcare sector becomes the cornerstone of a net zero carbon society, they will offer a sign of hope that the many people that depend on them, especially in communities that are vulnerable to climate change. At the same time, the IKEA Foundation has a long-lasting partnership with Médecins Sans Frontières, Doctors Without Borders, focusing mainly on the so-called hidden emergency work, such as the Ebola pandemic. We are delighted to hear that the Healthcare Without Harm is in dialogue with Médecins Sans Frontières on working together on climate and sustainability issues. Today, I'm talking to two experts from both organizations, Josh Karliner, the Director of Healthcare Without Harm, and Dr. Maria Guevara, International Medical Secretary of Doctors Without Borders. Welcome both, Josh and Maria.
It's a pleasure to be here.
Yes, thank you.
Thank you, Josh and Maria. I would like to give you both the introduction, the possibility to introduce yourselves. Maria, can I start with you?
Sure. So hello, everyone. Greetings from Geneva. As said, I'm Dr. Maria Guevara. I'm the International Medical Secretary for Doctors Without Borders, or Médecins Sans Frontières. I just want to take this moment to say thank you for having us here in this dialogue, especially inviting MSF to be part of this great conversation. Also grateful for the ongoing collaboration with IKEA Foundation, which I believe is more than 7 years now. It's really exciting to be taking the shift in this moment in time together and putting that climate lens on. And also, Josh, always a pleasure to see you and to share this dialogue with you. I'm sure we'll have great ideas coming out of this exchange. Thank you again.
Josh, over to you.
Hi, everybody, and thank you, Edgar. As Maria said, it's a pleasure to be here with everybody today. Thank you so much for inviting us. Healthcare Without Harm is a new partner of the IKEA Foundation, and we're really pleased to be working with you on the important issue of climate change. My role at Healthcare Without Harm, which is an 25-year-old international NGO, is International Director of Program and Strategy, and I'm based in San Francisco, California, where the sun has just come up.
Thank you, Josh. Okay, so then let's start with the session. So I'm turning my attention first to you, Josh, for this first part. I think maybe a nice topic to start with is actually the name of your organization, Healthcare Without Harm. It's kind of intriguing because it sounds like a paradox. Could you explain to our audience and tell us something about your organization?
Sure. Well, we were founded on the paradox that healthcare, which is there to heal and whose mission is to protect people's health, actually creates pollution that negatively impacts people's health. And so based on that paradox, we built this organization that takes as its point of departure the Hippocratic Oath that doctors take when they become medical professionals to first do no harm, and applied it to sort of the broader ecosystem in which healthcare exists. And as I said earlier, we've been around for 25 years. We have offices on 3 continents. So we have an office in Brussels for the European Union, one in Manila for Southeast Asia, one in the United States as well. And then we have a team of people working across Latin America, strategic partner organizations in Brazil who represent our interests, in South Africa, in Australia, India, China, and Nepal as well. And we have a global network of hospitals and health systems that are committed to reducing their environmental footprint in 72 countries, 1,500 healthcare institutions that represent about 44,000 hospitals and health centers. And so this is a growing movement in healthcare to address sustainability issues, and central to that movement is taking on climate change.
Great, super exciting. So I know that Healthcare Without Harm is creating a global roadmap to fully decarbonize the healthcare systems around the world, taking into account local circumstances. Could you explain something about the importance of trying to decarbonize a whole sector and reducing its environmental footprint?
Sure. So, healthcare is a huge sector of society. It's 10% of world GDP. It employs tens of millions of people around the world. It exists at every level of government, whether it's in local government, it's in state or provincial government and national government. It has international institutions like the World Health Organization. And as we've seen through the COVID pandemic, it plays a central role in our society. And what we found when we started looking into this, and we produced a study of this a little bit over a year ago, is that amazingly, healthcare contributes to 4.4% of net global greenhouse gas emissions. So that means if healthcare were a country, it would be the 5th largest polluter on the planet in terms of climate change. And so, we set out in collaboration with our partners around the world to figure out how we can align healthcare and the health sector and align global health goals of achieving health equity and access to healthcare and improving the quality of care with the global climate goal of getting to net zero emissions. And so we're in the process now of building a global roadmap that identifies a series of pathways and trajectories to move the sector to net zero. And, especially again, hopefully coming out of this COVID moment that we're all suffering through in so many ways, healthcare, we believe, can emerge as a leader, a leading voice, a leading advocate, and a leader by example in terms of moving towards zero emissions and protecting people's health and the planet's health from climate change.
Thank you, Josh. Super impressive. I'd just like to take this moment to remind everybody in the audience to please feel free to ask questions. You can put them in the chat, and then those questions will come to me, and we'll be able to pick them up. Continuing first with my next question, Josh, could you perhaps give us examples of how to decarbonize the healthcare system? Because I believe it's indeed not only about the emissions within the walls of a hospital, for example, but it's very much also about a supply chain. And can you share something about what's already happening? Are there successes to celebrate?
Sure. I mean, there are 3 big levels that we see that healthcare needs to take action to decarbonize. One, as you mentioned, is actually within the hospital walls itself, and there's a lot that hospitals and health systems can do in terms of implementing on-site renewable energy, addressing emissions, fugitive emissions from anesthetic gases, managing their waste and reducing their waste, and many other things, investing in sustainable transport fleets. Excuse me. And at the same time, 70% of healthcare's emissions come from the global supply chain. And so, we have this huge healthcare industry, the medical device manufacturers, pharmaceutical companies, and the purchasing of food to serve patients and staff. All of these products and services that healthcare consumes have a significant carbon footprint. And so one of the things that we're doing at Healthcare Without Harm is to mobilize the demand of the healthcare sector and bring together hospitals and health systems from around the world to say, we want sustainable products. We want products that are, excuse me, 1 second, I'm sorry. We want products that are produced with low carbon or zero emissions. And by doing that, we can mobilize the collective purchasing power of this huge sector of the global economy to actually transform production and consumption. And yes, there are examples from around the world of hospitals and health systems that are taking action. So the biggest and most important example right now is the National Health Service of England that is committed to zero emissions by 2047 and has issued a plan how they're going to get there. They're the largest national health system in the world, and they're a leader in this effort. But we also are seeing hospitals and health systems in the United States do the same thing, and hospitals and health systems in low-income and middle-income countries using low carbon or zero emission strategy to power healthcare in situations where they don't have access to energy. So zero emission strategies can both reduce the footprint of healthcare in countries that are big emitters, while also help provide better health services in countries that are low emitters.
Thank you, Josh. We do have questions from the audience. Could you perhaps explain one more time, as we are talking about the supply chain, how the healthcare sector emits carbon? Because that may not be obvious for everyone directly. So, what are kind of the main contributors? Yeah, what is the most polluting factor?
Sure. I mean, so there's something that some of you may be familiar with called the sort of greenhouse gas protocol scopes. So there's scope 1, which is on-site emissions for any industry, scope 2, which is purchased electricity, and then scope 3, which is the broader supply chain. And so healthcare has significant emissions in each of those scopes. It buys a tremendous amount of electricity. Hospitals have to be open 24/7. They consume more electricity than most commercial buildings or any other commercial building for all the operations that they have internally. They have to have temperature control. Many hospitals spend a huge amount of resources on cooling, for instance, especially in warmer climates. So there's that. And that has to do with the on-site emissions as well as the purchased electricity. And then there are all these products that healthcare buys. So and the packaging and the transport of those products. And again, it's 10% of the world economy. And so MRI machines, everything from MRI machines to syringes for vaccines are all produced in a carbon intensive way. And so all of these can move to zero emissions. And also, I mean, I think, in this moment with this pandemic, we're seeing opportunities to actually transform the sector as we address the pandemic. So one way is that vaccines, as they're distributed around the world, are going to be needed to be, as everybody knows now, maintained cold through a cold chain. And a lot of countries don't have sufficient cold chains to be able to deliver vaccine to their entire populations. And so there's going to be a lot of investment in new cold chain infrastructure. That cold chain infrastructure can be fossil fuel powered, it can be energy inefficient, or it can be based on clean renewable energy. It can be energy efficient, and it can be climate smart. And so there are tremendous opportunities as the world invests in COVID response and recovery to build back better in healthcare and make the sector a shining example of how to be climate smart and how to move towards zero emissions.
Thank you, Josh. Could you perhaps, I see we have one more question coming. Somebody says cold storage demands a lot of energy, but it's more important than ever with COVID, for example. Is your organization doing work in this area, and what could it mean for emissions reductions?
Well, yeah, so one of the things that we've looked at with the roadmap that we've done is that if we continue with business as usual, healthcare's emissions will triple by 2050. Even if we implement all of the Paris agreements, healthcare's emissions will still significantly increase. It will increase by 50% of what they are now. And so the cold storage question is one of which way are we going to go? Are we going to lock in carbon intensive infrastructure into the future, or are we going to take action and actually align our investments in health with our need to protect health from climate change by moving towards zero emissions? And so, we work with a lot of other groups, some of which I think IKEA Foundation is involved with, like the Kigali Cooling Efficiency Program and others, to identify what some of these solutions might be and to promote them. And we actually will be releasing a report. The World Bank will be releasing a report that we worked on with them in a month or two that sort of sets up some criteria around some of the cold storage issues in terms of the vaccine cold chain for the future. Hope that's helpful.
Absolutely. I think it is. One more question from my side. What are the key challenges to decarbonize the healthcare system, and why will you succeed?
Well, I mean, I think hopefully we will succeed. All of us working on the climate issue, we need to succeed, right? This is one of the fundamental challenges of our time. I think one of the biggest challenges has been getting the health sector to realize that it has a responsibility around climate change. But that's really changing. I think the health sector's really woken up. And I think when we hear from Maria, we'll sort of hear about some of that awakening in MSF. But that's happening all over the world right now. And so we're seeing a growing number of hospitals and health systems committing to zero emissions. And so I think we're overcoming that challenge. And at the same time, I think a lot of folks on the climate side of things didn't see health as important. And COVID's changed that. And so there's this coming together like never before of the imperatives of health and the imperatives of climate. And there's a huge opportunity there, I think, that we can all take to basically not just talk about polar bears, but talk about clean air, and not just talk about endangered species, but also talk about the growing burden of disease. And that's the challenge, and the opportunity is to bring those two together.
Just a quick question, Josh, because that's actually also a link to a bridge to Maria. But climate change, how does it affect health? I'm sure that could be a long answer, but if you could highlight some points.
Yeah, I mean, it's fundamentally, I mean, the way the World Health Organization's put it is, climate change is the biggest health issue of the 21st century. And think about that. Think about what we're living now with this pandemic. And the biggest health issue of the 21st century isn't this pandemic. It's climate change. And it affects human health in so many different ways, in terms of the migration of different infectious diseases, and in fact, the potential generation of pandemics, to the increasing impacts on human health from temperature change, from the increased severity of storms and floods and droughts. I mean, if you look at what's happening in the United States today with these bizarre snowstorms in Texas, if those may well be climate attributable, and they're having a huge impact on people's health. It's killing people. And so there's so many different aspects of it, but when you put it all together, there's a huge set of health impacts that I'm sure Maria can elaborate on.
Thank you very much, Josh. Yeah, then so indeed, turning to our second expert of today, and later we will see Josh back, Dr. Maria Guevara. Maria, you are currently the new International Medical Secretary of Médecins Sans Frontières, and the former advocacy advisor. Could you tell us something about your work?
Sure. But first, I think, Josh did such a great job of explaining the impacts. I don't think I have any work done to do here. Anyways, yeah, so that's a big question to answer, but maybe it might be important to first situate everyone on, especially or in case there are those in the audience who are not so familiar with Doctors Without Borders or Médecins Sans Frontières. In short, we say MSF. So I'll use MSF just to speed things up because it is a mouthful. But so MSF is an independent international medical humanitarian organization. We are founded in 1971 in the wake of the Biafra War in Nigeria. And since that time, we've grown from a workforce of about 300 people to over 45,000 to date globally. And we work in over 70 countries. We provide medical humanitarian assistance to populations in need without discrimination on any basis of race, sex, religion, creed, or any political affiliation. And work a lot in context of epidemics, endemics, and natural disaster and conflict. In my role as the International Medical Secretary, which I've just literally took on the beginning of this month, is working as a key member in the MSF, what we call International Office, which oversees and supports our operational centers where the big bulk of the work of the activities we do globally are actually being coordinated. So we support in the coordination, the information management, the representation as well. And I work basically in a trio with our Secretary General and International President in trying to promote medical leadership and ensuring our accountability to our strategies and direction in our representations. In my previous role, though, as the Senior Advisor in Global Health, part of my job was to help the organization situate ourselves within the global humanitarian landscape and highlighting the stakes and challenges of today. So, of course, climate change and environmental degradation sat right at the top of the docket, not only because clearly I'm quite passionate about this issue, but as Josh already said, it's the biggest health threat, global health threat of the 21st century, or some now we can reformulate that as perhaps an opportunity. So along with many in the advocates in the House, we've been actively pushing MSF, including the larger humanitarian sector and as a health actor, to take this important issue on as a social mission responsibility. And I think we're succeeding slowly but surely.
Thank you, Maria. And do you think actually that at present the links between climate change and humanitarian medical emergencies are sufficiently clear to everyone?
Yes and no. So clearly the science is out there. So 30 years over plus of research on climate change and health, in fact. It's been a narrative in the scientific arena, but in the public arena, unfortunately, it's been harder to see. So it's like a slow burn for many. And so it's easier to ignore, partly probably because the impact so far has been disproportionately felt in what they've been calling climate hotspots. And incidentally, those same areas are the humanitarian hotspots. So as a humanitarian worker, we're quite close to this. And unfortunately, also, these hotspots tend to be blind spots for the rest of the world. So, and when I do presentations, I like to show this slide on the tail of two maps, with one map highlighting where the vulnerability sits, and usually it's south of the equator, and then where the responsibility to climate change sits, which is usually the global north, for lack of a better description. And then you interpose the MSF activity map on that. It's striking to see where it matches quite well with the vulnerability maps. For MSF, our role is not necessarily to define the causes and the consequences, because of course scientists are doing that analysis, but it's really highlighting, our experience in the field of humanitarian emergencies and needs, that it is rather complex and multifactorial. And what we are seeing, it is just really getting worse. And so it's not only for us to respond and answer to those needs, but actually lend our voice to highlighting the trends we're seeing and help bear witness to the reality of today.
Thank you, Maria. At this point, I would like to remind the audience that you can ask questions to Maria. So please pose them, and I'll be more than happy to ask them. So Maria, just picking up on the last point you made, you mentioned indeed you are often firsthand eyewitness when the world, where the world's most drastic crisis happen, sometimes strongly correlated to climate change. Could you perhaps provide examples of that?
Sure. So, I mean, maybe first maybe to refer to the Lancet Countdown reports that's been ongoing for some years now. If for those who are not familiar with it, maybe it'd be good to become familiar with it. And also to say that for the last 3 years, MSF has been contributing and writing some of the policy briefs to the Lancet Countdown report, where we basically are just describing what we're seeing in our daily work and what our patients and staff are experiencing. And in fact, it's actually when I met Josh at the COP24 in Katowice, which during the presentation that I was giving on our findings for that year at the Global Climate and Health Summit. So in this last report, maybe I can cite a few of those elements that we wrote in that Lancet Countdown 2020 report. So some of the three of those are adaptation, and maybe I'll mention a little on mitigation. So one of them is a climate-related migration that we've noted in our work in Bangladesh. So we've been in the country for in and out since 1985, and more recently in a growing impact, we're watching how the climate change-related shocks are actually contributing to the mobility inside, whether that's the floods, whether that's a chronic situation of drought and desertification, and even salinization of the water. We do see significant internal displacement within the country, of course, also exacerbated by refugee flows from across the border, in this situation, of course, in Myanmar, for example. And what we're seeing is the internal displacement of the people, they tend to then move into this informal urban settlements, which exposes them to significant insecure living conditions, water, food insecurity, and heavy pollution and hazardous workplaces. So what we're doing, for example, in Dhaka's Kamrangirchar slums, which is right in the heart of the capital city, we're running primary healthcare and occupational healthcare supports to those people who have been displaced there because of flooding or saltwater contamination of their farmlands. And also in South Asia, we're seeing in our work in Pakistan, where we've also been since 1986 in and out, where we came into the country because of conflict and natural disasters. But in recent years, we're seeing a significant rise in heat waves and heat-related deaths because of, since 2015, for example, we're seeing significant heat, hot summers that are exacerbated with power outages, especially in the southern regions, and it's causing record numbers of death because of those exposures. So what we're trying to do is adapt our emergency response and preparedness according to that, and seeing how we can address these deaths and injuries and try to mitigate those, also including community sensitization to help the communities to work on how to prevent those heat-related illnesses. And then on the adaptation in Haiti, we're looking at how do we anticipate climate changes that contributes to waterborne diseases like cholera, or even vector-borne disease like dengue and chikungunya, which we know are also increasing. So we're using anticipation models to forecast better, and so we can better prepare. I also wanted to mention a bit on the mitigation practice lastly, and follow up to what Josh was saying about the do no harm principle. It is something that is important to us as well, especially at MSF. It is a paradox of the work that we do, but what we are looking at beyond decarbonization is also, how we're managing the wastes. In the wake of COVID, there's a lot of production of waste issues with all the protective personal equipment out there. Just medical waste in general, we're looking at how to change those models in a way that's more environmentally friendly and sustainable and consistent with our humanitarian care. I'll just stop there. I could go on forever.
Thank you. Yeah, no, it's super interesting to listen to you, Maria. And there is a question from the audience from Sonal Mahajan, who is asking, are you also focusing on reducing plastic footprints? You already mentioned that actually in your waste, in the part that you addressed on waste, and focusing on the usage of, for example, biodegradable raw materials.
Yeah. So that's a great question. It is something that we're deliberating now. How can we look at single use versus a more sustainable way and biodegradable? It's a balance between medical care and infection control. And this is one of the reasons why single use have come to light. And where this balance of really, strict standards of clinical care with managing the waste. So it is in reflection now. How can we add our experience to that and work to see how we can work with companies, or at least look at our procurement supply chain to make it more sustainable and see where we can make those the voices we need to expand on to make sure that those elements are being considered from the health sector perspective.
Thank you very much, Maria. Great that you exploring this. Then one more question. I do not say the name of a person, but this question goes, very grateful for the essential work that MSF has done in the past and now. In your experience, how important is decent living and decent housing to health in vulnerable groups?
Right. So, a lot of what we do is obviously the after effects of all the social inequities and inequalities, the structural violences of society today, and obviously linked to poverty. While we don't necessarily address the causes per se of poverty and all that, we do unfortunately end up managing all of the consequences. And just to state that, in the global health narrative, health is a state, if you actually look it up in the WHO terminology, it's not just a state of well-being and good health, it's also a state of the absence of disease. And now there's this growing look at the social determinants of health and how do you work within that ecosystem, looking exactly at, the social environment. But now we're also trying to develop our narrative around the environment itself, right? The ecological aspects as much as the social determinants. So environmental determinants is also an important issue. It's a narrative that we have to integrate within our work, especially in the way we analyze contexts, the way we do assessments in the field, to make sure that we are, if not us pushing it at the high level regarding the poverty, etc., that at least we can work with partners who may be able to do that.
Thank you, Maria. Then one last question before we turn to Josh as well, the both of you. This question is, humanitarian sites are sometimes set up quickly with old methods. Easiest are sometimes diesel generators, which are hugely polluting, as we know. How far do you think we are from facing these?
I hope not so far, but unfortunately, probably farther than we would like. So the humanitarian sector, in my opinion, only is quite slow. Like, I think the world in general is slow to answer to climate change and environmental degradation, but we're getting there. We're working on it. And, from the UN perspective, and I'm not a UN, so take this with a grain of salt, there is a lot of work on, looking at different assessment tools that we can really look at how the environment is, and then what would we do? What would it look like after our intervention? So that is one of the things that are coming up, and something we're trying to look at integrating within MSF. More practically, it is one of the biggest pillar of action is, so rather not just adapting our operations to be better prepared, to analyze better, anticipate, but one big pillar is in the environmental footprint. And there we have been for quite some time looking at different hybrid solutions and running our projects. We've started to integrate solar panels. We're looking at solar run ACs, for example, which is needed for cold chain, for our stocks, but also in our facilities, like, in the operating theaters and in our recovery rooms, etc. We are starting to look at how we can move from the diesel generators. In some places, unfortunately, we can't yet, but we are looking at trying to see how that can be done. We've launched these projects to really deep dive and pilot in different countries monitoring systems, so we can see where energy is leaking. So it's not just a move to adapting new technology, but really looking at our behavior, right? It's also behavior change. Where are we wasting existing energy today? And so that is one other aspect that we're looking at as well.
Thank you so much. Then I would like to bring Josh back as well, to have both of you. In the final part, I would like to address some of the questions that are really at that point where health and climate are meeting. The first question is climate change as an indicator of planetary health and human health. Both are very intrinsically related. They also share some similar causes and solutions. COVID-19 is a good example, and it's among us. It touches all of us. Could you elaborate a little bit on the relationship between COVID and climate?
Should I go first? You want to go first, Maria?
Well, I'll be brief. So yeah, they're two seemingly parallel yet quite colliding crises. They're both, I think, to some extent unprecedented, but they're just running at different timelines, right? So you have both of them are, again, like I mentioned before, highlight the stark inequalities and inequities and injustices in our social system today. And they put front and center really the meaning of vulnerability and responsibility. And unfortunately, both are, as we've already seen with COVID, set to outstrip our existing system. So COVID and our healthcare system, but in general, the whole system of society, climate change will do that at the longer distance. So COVID-19 really is showing us in full frontal way what lies ahead with climate change. And it's really asking us collectively in no uncertain terms that are we ready? And sadly, we're not.
Yeah, I couldn't agree more with what you just said, Maria. I think there's some common causes that I think many of us have heard about, in that the environmental degradation, the deforestation of lands, the encroachment on natural ecosystems by human settlements, has the potential to liberate more and more virus, which can lead to pandemic. So there's a common cause in that way. That some of the same drivers of climate change drive the potential for pandemics. The impacts, as Maria mentioned, highlight the great inequality in the world, both between nations and within nations, in that the poor and the most vulnerable are the ones who suffer most from the impacts of something like the COVID-19 pandemic. And they're also the populations that are hardest hit by the impacts of climate change. Some of the solutions, I think, also can be common solutions, in that we need to transform our societies into more equitable societies that are less polluting and less destructive of the environment. in order to solve for or prevent both problems. And there are also some key issues that are emerging from the COVID pandemic that we need to address. So Maria mentioned healthcare waste as a big issue. It's something that Healthcare Without Harm has worked on for quite many years. And we're now seeing the potential for a huge healthcare waste crisis related to the essential vaccination campaigns that need to happen around the world. So, I mean, imagine billions and billions of syringes being disposed of in places that don't have adequate waste management systems. And it's something that MSF and Healthcare Without Harm and several UN agencies and others are working on, trying to develop some solutions to and some responses to, so that we don't have a massive waste crisis that impacts human health that comes out of a response to COVID. We have other examples of, in India, for instance, in the state of Chhattisgarh, they're installing renewable energy in all of their health clinics. That makes them more resilient to extreme weather events. It makes them more resilient to the impacts of pandemics, in that they will have energy that will allow them to have refrigeration and cold storage, and to be able to serve a greater population because they have that renewable energy off grid. So there are a lot of other examples like that. I know we don't have a lot of time, but I think there's a lot of ways that both the causes come together, but also there's some of the solutions that come together in a way that we can build pandemic-proof, climate-smart health systems in the future.
That sounds really great, Josh. I think we are entering our last question, after which we will have to close off for today. But and this question is, since we work hard to rebound from the pandemic, healthcare workers have been hailed as heroes, and rightfully so. Do you think now is a good time for them to be talking about climate issues? And would you think that they have actually time to talk about climate issues, given all the pressure that is on them with COVID-19 alone already? And how could you amplify their voices? What is their target audience? Who should they be talking to?
Should I go ahead? Because I know you have a lot of answers. I'll debrief again. So as a healthcare worker myself, I actually asked that question, and I go, I wonder, do we actually have a choice? I mean, in fact, whether we're a medic or not. I mean, what is interesting though about being a healthcare worker is, if I, as my good friend and also MSF volunteer and biggest planetary health advocate and ally I know, Dr. Courtney Howard, used to say in her presentations that in many surveys, we still see that despite COVID, doctors are still more trusted than politicians. And that's confirmed, in even latest surveys, even in Canada. So but as with everyone, I think education and awareness of the issue is a first step to really empowering healthcare workers and health communities at large to not only pay attention, but also become outraged enough to speak about it, about what they see in their emergency rooms, and bear witness to it. This témoignage component, or this bearing witness component, is at the core of what MSF's work is. It's in our charter and principles. And the aim is really to shed light to society, including and especially governments and those making policies and laws that can make those needed change for the better. It is, I think, a collective responsibility for all to work with, not, as humans, we drive the issue. We're part of the cause as much as we can be the solution. And I think it's not only a public health priority though, but a moral imperative for society.
Well, that's a hard one to follow. I guess all I would like to say is, huge respect to all of the healthcare workers who have been on the front lines responding to this pandemic. They've put their lives on the line, and they are leaders and the truth tellers in our society. And we at Healthcare Without Harm, when this pandemic first began, asked that same question, Edgar. It's sort of like, well, do we stop? Do we just wait? And what happened was sort of what Maria just said. People came to us and said, we don't have a choice. We have to do both. we have to address both issues. And what we've seen in our network is 5 new countries, hospitals and health systems from 5 new countries joining our network during the pandemic. You know, more than 50 different healthcare institutions joining our network. We've seen the NHS commit to zero emissions. We've seen hospitals and health systems in multiple other countries make climate commitments. And we see this growing momentum. And so, you know, I think that not only is the health sector itself recognizing that it's got to walk and chew gum at the same time. It's got to be able to deal with multiple crises simultaneously, and that these crises are interrelated. We're also seeing the growing advocacy from doctors and nurses, the most respected professionals and most respected spokespeople in our society on climate change. And that's happening during a global pandemic. So I have a lot of hope that, you know, that we have an emerging health movement on climate change that's going to help build a broader societal movement to take on this existential threat to civilization.
Thank you very much, Josh and Maria. This was super interesting for me, and I believe for the audience as well. Unfortunately, time's up. It always goes too fast. I have the feeling we could talk for hours about this. Tremendous thanks to you. It was super interesting. I think you have shed light on the complexity, but you have shed light on the linkages between climate and health, and you have also given us signals of hope. With that, I would like to wrap this up and hope to see you at some next occasion.
Yeah, thank you so much, Edgar. Thank you so much, Josh and Maria. Really an incredible session. And I think just to echo what Edgar said there, it's so amazing to think about these two things together. It's something I think we don't always put together, and it's really important. As you said, do we really have a choice right now? So really grateful for both of your work, really grateful that you are continuing this, because this is something that we don't have time to wait for anymore. So thank you so much, really appreciate it. Just so everyone knows, we have a new thing coming from Ask an Expert, and that is on Tuesday the 23rd, this coming Tuesday at 2:00 p.m. Central European Time. We're going to do a quick wrap up. We're going to try and take this 45-minute session and turn it into something that's about like 5 or 10 minutes, where myself and our Head of Communications at the IKEA Foundation, Truce, are going to talk through this, show a couple clips, and just really give you a quick idea of what happened. So if you didn't have a chance to listen to the whole thing, tune in on Tuesday. And also on Thursday, 4th of March at 3 p.m. Central European Time, we have Demiola Ugunbi, who's going to be our next Ask an Expert guest. So please tune in for that as well. With that, let me just add everyone back in so we can give you a little wave goodbye. So huge thanks so much to Josh and Maria for taking the time today. Hope everyone enjoyed it. And of course, if you have any other questions, you can ask them in the comments, and we'll try and get them answered for you. Thanks, everyone. Have a fantastic day. Bye.